right, so we'll go ahead and get started. Just want to start off by welcoming everyone to the second of 8 webinars in our Project Firstline Infection Prevention Essentials webinar series. My name is Jenny Winkler, Director of Quality, Safety, and Health Policy at the Illinois Health and Hospital Association. So we're going to go through a couple of housekeeping items first. And so as we're doing that, I encourage all of you to please complete the poll on the right-hand side of your screen. Results from the poll are only going to be seen by the presenters and not shared with participants on the line. So after you've selected your answers, make sure that you click the submit button so that ensures all of your answers are received. Just a couple announcements now before we get started. Due to the large number of participants that will be on the line, everybody has been put on mute. We will have a lot of opportunity to comment and for discussion during today's session. So when you want to speak, to take yourself off of mute, you'll click on that unmute button at the bottom of your screen. For those of you that are not on WebEx and are dialed in just using your phone, you will hit *6 to unmute your line. We also encourage you to utilize the chat box throughout the presentation, and you can find that also on the lower right-hand side of your screen. Finally, just want to make you aware that this webinar is being recorded, and by attending today's webinar, you are considered to have been consented to being recorded. If you do not want to be recorded, please exit the webinar now. A copy of the slides and the recording from today's presentation will be sent to everyone that registered following today's presentation, as well as posted on the Chicago Department of Public Health's Healthcare Associated Infection website. With that, we want to start by, again, welcoming you to the second of 8 webinars in our webinar series. This series really is intended for frontline healthcare personnel, regardless of their infection prevention training or background. These sessions will provide that foundational knowledge for you all to confidently apply infection control principles and protocols necessary to protect yourself, within your facility and also your community. We will be utilizing education materials from Project Firstline, the Center for Disease Control and Prevention's collaborative that's aimed at providing infection prevention training. We truly appreciate all of the great work that you all do to serve your patients and communities, and are really looking forward to connecting and learning from all of you during this webinar series. This program is accredited by the state of Illinois for 1 hour of nursing continuing education credits. Only those attending the live program will be eligible for the continuing education. Following today's webinar, you will receive a survey via email, and you will need to complete all of the required fields in that survey for continuing education credits. And some of those include by providing your nurse license number, the time that you've joined, and the time that you exit today's program. And that survey will need to be completed by Wednesday, May 11th in order for you to receive those credits. If there are multiple people in the room with you today, please be sure to send that survey link to those that are in attendance. And then within 2 to 4 weeks following the close of that survey, respondents will receive their continuing education certificate from Illinois Health and Hospital Association staff. And in addition, everyone that's participating in today's webinar will receive a certificate of attendance indicating that you participated in today's session. So with that, I would like to, the Illinois Health and Hospital Association has partnered with Chicago Department of Public Health to host this series to support your infection prevention training needs. And so you will be hearing from everybody that's highlighted on the slide throughout this webinar series. Okay. So with that, I would like to just start real quick by introducing you all to Project Firstline. The Center for Disease Control and Prevention's Project Firstline initiative really aims to provide that infection prevention and control training for frontline healthcare workers with the goal of supporting their efforts to understand and confidently apply those infection prevention principles. There's multiple components to this initiative that you can see highlighted on this slide, and real quickly just going through those. That includes conducting a learning needs assessment of frontline healthcare workers in the city of Chicago in an effort to identify training needs and gaps. That assessment occurred at the end of last year, and the results from that assessment were shared during our first webinar. For those of you that might have missed that first webinar, you're welcome to listen to the recording or download the slides, and those will be posted on the Chicago Department of Public Health's website. The results from that assessment is what helped us to identify the topics that we wanted to cover during this 8-part webinar series. The next piece of this program was promoting awareness and facilitating the CDC's Project Firstline infection prevention training curriculum, which is what we're doing right now. And so a lot of you on the line are seasoned infection preventionists or have had some type of infection prevention training in the past. And so as you go through these series, you'll see that a lot of this is basic information and truly geared towards those building, on that foundational education. There's going to be a lot of opportunities for discussion during each one of our webinars. So we'll have an opportunity to hear about everyone's experiences and to learn from our peers. And so we would welcome any of you that have, background or experience in infection control to participate in our webinars, to share your knowledge and really serve as mentors for those that are in the early stages of learning about infection prevention practices. And then the last part of this work is evaluating our training sessions to make sure, that we are providing meaningful learning for all of you. So with that, we'll go ahead and dive into today's topic, and we're going to be talking about environmental cleaning and disinfection. So this slide highlights the objectives that we're covering today. We'll really spend a lot of time talking about the difference between cleaning and disinfection, why it's important to follow the product's labels, and then we'll also talk about what contact time is. And so let's see, next slide. I just as we're starting this, we talk about cleaning and disinfection, and we do a lot of cleaning and disinfection in healthcare, but just taking a moment to pause and think about, what does that mean? Do we actually know what the difference is between cleaning and disinfection? And so I'm going to open a poll here. Just want to get a sense. Please pick the sentence that you all think best describes cleaning and disinfection. Is that A, cleaning kills germs and disinfecting removes dirt and some of the germs? Is it B, disinfecting is a type of cleaning where we clean with chemicals? C, cleaning is a type of disinfecting where we disinfect with soap or detergent? Or D, is disinfecting when we clean germs, and cleaning is when we remove dirt and germs? And so feel free, pick which one you think is the correct answer. And then also, in the chat box, let us know what your role is with cleaning and disinfection in your organization. We'd love, again, to hear from you and learn about everything that you all are doing. So I'll give you a minute to go ahead. There's a couple people that haven't necessarily answered the poll yet. A couple more seconds. Okay. All right. Okay. And so as you can see, the poll results, D was the correct answer. Disinfecting is when we kill germs, and then cleaning is when we remove dirt and germs. So thank you all for doing that. And thank you for those of you that are sharing, what your role is in the chat box, and hope to continue to hear from you as we move through today's webinar. So we're going to talk about cleaning and disinfection and what those differences are. And so we're about to watch a video that walks us through these differences. So I'm going to play a brief video from Abby Carlson, who is an infectious disease physician at the Centers for Disease Control and Prevention, who talks about the differences in detail. As you're listening to Dr. Carlson, I encourage you to think about moments in your daily work where you might clean and disinfect different surfaces or different objects. And just a note, so participants that have dialed in on their phones, you're going to need to turn the volume down on your phone and make sure that your computer speakers are on and not muted, and that the volume is up. And so that will ensure that you're able to hear our video correctly. So give me a moment. I will go ahead and pull up this video. So Dr. Carlson, talked about the difference between cleaning and disinfection, and I hope you guys were able to start thinking about how this applies in your organization. So as you heard, cleaning is that process that really does remove the visible dirt, dust, spills, smears, and grime, including organic material like blood or other body fluids that might be on surfaces in our healthcare facilities. Again, would encourage you to share in the chat some of the examples about when you clean and disinfect in your day-to-day role, or are there different objects that you might clean or different equipment that you're responsible for cleaning and disinfection, just to hear about what your experiences are. As Dr. Carlson highlighted, it really is important to clean before disinfecting because that dirt and grime prevents our disinfectants from working correctly and also, could keep them from working at all. So we really need those disinfectants to work because they are the products that kill the germs on surfaces, on the different objects and the different equipment in our facility. So again, still, we know that there's a variety of healthcare providers on the line that work in different healthcare settings. So it is great to hear from everyone, if you're comfortable sharing what your experiences are. Again, I think the key point of that, before we move into the next activity is really understanding that the cleaning process has to happen before disinfection, unless you are using a product that is specifically designed to clean and disinfect at the same time. And we're gonna talk about that in more detail as we go along. So in a moment, what we're going to do is we're going to split up into 3 breakout rooms to talk through cleaning and disinfection scenarios that occur in healthcare. Each group will be thinking about a specific scenario, and we'll talk about the questions that are highlighted on this slide. You will have an opportunity to join any of the breakout rooms that depict a scenario that you would likely encounter in your day-to-day work. So those scenarios include, needing an item from a shared cart for a sterile procedure. You finished examining a patient and are writing notes in a patient record, or picking up a patient's tray after lunch. And so we really want to think about, what are the risks with these activities for germs to spread? Or what questions about disinfecting and cleaning should we be asking? And then as well as what action should we take as it relates to these scenarios? If these are scenarios, even though they might not be something you specifically perform as part of your job, we still encourage you to participate and just think about how the healthcare team works together to keep the environment clean. Each breakout room will have a Project Firstline team member serving as a moderator. We'll have 15 minutes to discuss the scenario, and then at the end of the discussion, the groups will come back together, we'll share some highlights from our discussion, and then move on to the next part of that presentation. Again, there's a variety of healthcare providers with different levels of infection prevention experience on the line. So we might have an opportunity to hear about different recommendations or actions that we could take as it relates to cleaning and disinfection. So in a moment, on the right-hand side of the screen, you will see the different scenarios pop up. And you can click join to join the specific scenario that relates most to your work. All right. Good luck.
For those of you who are still in the main session, please join one of the sessions listed here on the screen. In order to do that, you may need to maximize your drop-downs on the right-hand side of your screen under Breakout Session. There'll be a little arrow on the side. If you click on that, you'll be able to see and then join from there. We would like everyone to go join a room, please. I can assign you from my end if you do not pick your own.
I'm having difficulties.
Please assign me. I'm having difficulties.
Oh, who is that? I'm sorry. What's the name?
Bridget Jones.
And is there a particular session you would like?
It doesn't matter at this time. I don't hold up the group. Thank you.
Okay, no problem.
Hi, this is Crystal Byer. I do not have an option for a breakout room, so if you could just assign me, I'm an infection preventionist. You can put me in any group.
Got it. Thank you.
Thank you.
Hi, this is Vanessa Marcus. I would like group number 1.
Got it.
This is Monica Myers. Could be put into group 2.
Okay.
This is Margaret DeSalvo. I don't care what you put me in.
This is Rachel Gala. If you can put group 1.
Okay, so hey, you guys, on the right-hand side of your screen, you'll see a couple of options. It probably look like participants, chat, polling. There's probably going to be one for breakout sessions as well. You might need to click next to the little inverted triangle to drop that down a bit. But I can keep, if you guys want to keep going with names, let me know. It does take, I can do it. It takes me a minute to find them. So I might have missed some of those that have already said.
Hi, Lori Swanson, group 1, please.
Yeah, I don't think this is working because there's nothing over on the lower right-hand side that tells you to. I see apps, participants, and chat.
Okay. So what we're going to do, just so everyone gets into a room, I'm going to go ahead and just assign everyone to a session
Sounds great.
randomly. So, thanks, guys.
No, I'm sorry. I know we just got cut off, so sorry about that, Bridget, but I appreciate your comment.
We apologize, everyone, for the confusion on the breakout sessions as well. I think we may have figured out the problem for next time, though. So we do appreciate your patience during that transition.
Thank you all. So sorry about that. So glad that we were able to still have some conversation, and apologies for those that might not have gotten into a breakout room. I think we're going to go ahead and just take a couple minutes just to walk through, some of the high points in each of the rooms. So I'll go ahead because our group was the first scenario, and I know everybody had a lot of discussion. So I think really, what our takeaways was that the cleaning and disinfection process in most organizations, it's a shared responsibility. We've heard, doing a lot of proactive rounding, educating staff, just on the importance of cleaning and disinfection, and also the steps involved with cleaning and disinfection is really important, because that's not something that's necessarily taught to new staff during onboarding, as well as just, regularly educating on some of those key infection prevention principles. So I think, for our group, we had great discussion, and I appreciate everyone that shared. Those are just some of the highlights on our end. So moving to group 2, I think, Allison, that was you, if you want to share.
Yeah, absolutely. I can kind of share some of what our group talked about. So for our scenario, it was you finished examining a patient and are writing notes in the patient record. So we got a lot of great comments about making sure, your hand hygiene is being observed appropriately, proper PPE use, all the high touch surfaces are being disinfected, everything's being cleaned. And we had some really great examples of potential areas that you should really make sure you're cleaning. Some examples of common high touch surfaces that could potentially be looked over in these scenarios, like specifically IV poles, curtains, portable workstations, keyboards, mouses, even pens. So those were some really great examples that we discussed in our group.
Allison, and then Shane, the last group.
Yeah, thank you, Jenny. So we talked about, in terms of like what the risks were in our scenario. So our scenario was, you come to a room to pick up a patient's food tray. So some potential areas for spread would be the high touch areas. I think a lot of groups touched on that, but bedside tables, the food tray itself, doorknobs. We also talked a little bit about the hands of the healthcare workers as being a potential source of germs. And then for some of our, questions about cleaning and disinfection, we should be asking, we talked a lot about like types of how to select a good disinfectant, the types of disinfectants, what organisms the label says they can kill if someone's on isolation, using a specific disinfectant for that. And then finally, we talked about what actions we would take, following, facilities procedures about cleaning, whether that be the, like the order in which the room should be cleaned, as well as just, paying attention to like if the patient has a specific need or there are specific things in the room that need to be cleaned, paying attention to those as well. And then Alex unfortunately got cut off, but we had such good discussion that we were coming up to the wire at the end, so I'm sorry about that.
Thank you so much thanks for sharing, and thank you all for sharing your question or your thoughts throughout that breakout discussion. So I'm going to go ahead and tag Christina to take us through the second half of this presentation.
Good afternoon, everyone. My name is Christina Boyd, Director of Quality, Patient Safety, and Health Policy at the Illinois Health and Hospital Association. So now that we've talked about the ways that cleaning and disinfection are part of your daily work life and the differences between the two processes, we're going to talk in more detail about why cleaning and disinfection matter. Cleaning is an important step because if we try to disinfect something that isn't clean, the disinfectant might not work. And we need the disinfectant to kill the germs. We'll go ahead and dive into why this is so important. I'm going to play another brief video from Dr. Abby Carlson at the CDC, who talks about this in greater detail. Now remember, that sound from the video is going to come across on your computer regardless of whether you're connected via the phone or not. So we suggest turning your computer speakers up, taking your computer off of mute, and then muting or bringing your volume on your phone down. Okay, so just give me 1 second to pull up that video. All right. So Dr. Carlson shared a lot of important information about why cleaning and disinfection are so important in healthcare. So next, cleaning and disinfection are critical in healthcare for so many reasons. We know that we don't want a dirty environment for our patients. One significant reason is because in healthcare, we have patients who are ill and may not be able to fight off infections as well as someone who is healthy. Germs are more likely to cause problems in these patients because their immune defenses might not be as strong as someone who is healthy. It's possible to see how some patients might be at risk of infection, such as if they have burns or wounds, or if they're having a procedure where germs could get into their bodies, such as when they have an IV or a catheter placed. But many patients' risk for infection can't be seen, like when a patient's immune system is weak because of the medication in their cancer treatment. It is important to keep the healthcare environment clean to stop germs from spreading. We have started a list on the right-hand side of the screen, but we also want you to think of some places that need to be cleaned and disinfected often. Feel free to drop your thoughts in the chat box. There are a lot of places that need to be cleaned and disinfected in healthcare. As we think, patient rooms. When a patient leaves a room or is discharged, before a new patient goes into that room, it should be cleaned and disinfected to make sure the germs don't spread. What about high-touch surfaces? We also clean and disinfect things that get touched a lot, such as bed rails, keyboards, light switches. These high-touch surfaces need frequent cleaning and disinfection. What else? It's also important to clean things in healthcare that aren't touched or shared as often, but tend to be dirty and have a lot of germs on them. For instance, toilet seats. These are just a few of the many examples of items in the healthcare environment that need to be kept clean. Now let's take a look at the chat for a few more examples. I already see on here TV remotes. Oh, that is so good. Even when I go into hotels, I am really weird about that TV remote. Workstations and computers, phones, the iPhones. Yes, those are another thing that I just in my regular environment are very concerned about. I think what are some other examples here? Shared workstations with staplers, the microwave, the clipboard, bedside tables. I know earlier I heard pens. These are all really great reminders of things that need to be cleaned and disinfected. So on to our next topic. So contact time. What is contact time? The next part of the webinar, we are going to show another video from Dr. Abby Carlson from the CDC, where she is going to take a closer look and tell us a little bit more about contact time. So give me 1 second to put that video on. All right. Okay, so Dr. Carlson told us all about contact time. And what we're going to do is we're going to move into the part of the webinar where we're going to talk about the disinfectants and the disinfectant label. So while you can usually judge if something is clean or not just by looking at it, this doesn't work with disinfection. Because germs are too small for us to see, we can't judge how well something has been disinfected just by looking at it. That's why following the instructions when you use disinfecting products is so critically important. All of the information we need to ensure that we are using the products correctly, it can be found on the product label. So what information do you need from the label to make sure you are using it correctly? In the United States, healthcare facilities use disinfectants that are registered with the Environmental Protection Agency, or the EPA. The EPA is charged with reviewing chemicals used for disinfection to make sure that they're safe and effective. Disinfectants used in healthcare facilities will usually have hospital grade or something similar on the label. Other information included on the disinfectants label that you'll need to know are which surfaces the chemicals can be used on, which germs the chemical kills, and whether the product should be diluted. And that means if you have to add water or another substance to bring the concentration of that solution down so that it's safe for use. If there are additional steps, those steps will be listed on the disinfectant label. So make sure that you look at that when using a cleaning product. So we know that we want to use disinfecting products at the right times and correctly, but what are some things that we don't want to do, right? So one of the biggest don'ts is don't rush the process. And we know that there is often pressure to rush. There are rooms that need to be filled, equipment that needs to be used. It is very important that the disinfectant has had the time to kill the germs. Also, we don't want to speed up the drying process, either by using a cloth to wipe it, or blowing on it using your breath, or even we do not want to use any kind of fan or anything to dry the surface unless that product label has told you to do so. We want to be patient when we are disinfecting, just making sure that we are not rushing that process. So the EPA has many resources about disinfectants for use in healthcare, and the list of disinfectants that are effective against different germs, including SARS-CoV-2, which is the virus that causes COVID-19. So the list for SARS-CoV-2 is called List N, the disinfectant that we use. We will include links to the EPA resources at the end of the presentation, as well as send that out in follow-up from today's presentation. So just moving along quickly, because I know we are nearing the top of the hour here. I'm not going to read the key takeaways, but please, we do hope that you learned something from today's presentation. We also have a list of upcoming session topics, as well as the broader themes that are covered in the Project Firstline materials. There also is a link to register for future webinars right here. We are doing one a week until the beginning of June. Finally, this slide, which you will receive in your follow-up email, highlights the different resources that are available on cleaning and disinfection, including that EPA website that we talked about, where you can find more information on the various cleaning products that you routinely use. We've also included the website for the Chicago Department of Public Health, where you can find additional healthcare-associated infection resources and the recording from these webinars. We do want to thank you again for attending today's second webinar in our series of 8. In the meantime, if you have questions or comments or would like additional information about how you can partner with the Project Firstline team to serve as a mentor for other healthcare professionals, we encourage you to contact us at the email listed on the screen. And then lastly, before you sign off today, we do ask you to, let me open this poll up here. Complete the poll that is going to pop up on the side of the screen here. I lost the poll. Let me bring it back up. In the meantime, if you are wanting nursing contact hours, you can go ahead and click on the, you can scan that QR code there to fill out the questions in the survey that are necessary to receive the contact hours. Alternatively, we will be sending those to that link to the survey to you in the follow-up email from today. And that poll is open up. I apologize for that. If you could complete that poll before you exit today, we would really appreciate it. And thank you again for your time today. And we appreciate all of your efforts to keep your patients, colleagues, family members, and community safe.